Good day everyone. My name is Ivan Costales from BSN 1C, and today I am going to assist a patient to move up in bed with the assistance of another nurse. So first, let's assemble the equipments: friction reducing sheet or other friction reducing devices, and non-sterile gloves and PPEs if indicated. Additional nurse caregivers to assist based on assessment, and full body seating lift and cover sheet if necessary, and based on assessment and availability. So next is the implementation. Review the medical record and nursing plan of care for conditions that may influence the patient's ability to move or to be positioned, and assess the tubes for lines and incisions or equipments that may, after the positioning procedure, identify any movement limitations. And next is perform hand hygiene and put on PPEs if indicated. So next, identify the client or the patient and explain the procedure to the patient, and introduce yourself. So with this, sir, my name is Ivan Costales from BSN University, and ako po yung magiging nursing for today. And siya po si Lawrence Costales, magiging assistant nurse po. And yung gagawin po for today is i-move up lang po namin kayo sa bed. Okay lang po ba yun, sir? Thank you. And next, close the curtains around the bed and close the door of the room, and place bed at an appropriate and comfortable working height, and usually elbow height of the nurse. But adjust the head of the bed to a flat position or as low as the patient can tolerate, and placing the bed inside and Trendelenburg and position aids movement if the patient is able to tolerate it. So the next one is remove all the pillows from under the patient and leave one at the head of the bed, and learning upright against the headboard. And next, position at least one nurse on the other side, and lower both side rails. And if a friction reducing sheet or device is not in place under the patient, place one under the patient's midsection. Okay, so next, ask the patient if able to bend his or her legs and put his or her feet on the bed to assist with the movement. So sir, bend niyo po yung paa niyo. Tapak niyo po sa bed. Hindi po. And next, have the patient fold the arms across the chest, and have the patient, if able, lift the head with chin on chest. So sir, pwede po ba kayo mag-gano'n? And then, chin niyo po, idikit po sa chest. Okay, so one nurse should be positioned on each side of the bed at the patient's midsection with feet spread and shoulder width apart, and one foot slightly in the front of the other. And if available on bed, engage mechanism to make the bed surface firmer or repositioning. And grasp the friction reducing sheet securely close to the patient's body, and flex your knees and hips, and tighten your abdominal and gluteal muscles, and keep your back straight. Okay? So next, shift your weight back and forth from your back leg to your front leg, and count 1 to 3. And on the count of 3, move the patient up in bed. If possible, the patient can assist with the move by pushing with the legs, and repeat the procedure. So 1, 2, 3, 4. 1, 2, 3, 4. So assist the patient to a comfortable position, and readjust the pillows and support as needed, and return bed surface to normal setting. And if necessary, raise the side rails and place the bed in the lower positions. And clean the transfer aids per facility policy. And if not indicated for single patient use, remove the gloves and the other PPEs if used, and perform hand hygiene. So, for evaluation, the expected outcome is met when the patient is moved up in bed without injury, and maintains proper body alignment, is comfortable, and demonstrates intact skin without evidence of any breakdown. And for the documentation, provide areas on the bedside flow sheet to document repositioning, and document the time that the patient position was changed, and use of supports, and any pertinent observations, including skin assessments. And next is document the patient's tolerance of the position change, and document aids used to facilitate movements. So that's all.